Greetings. This is Justin Allen with the Elite Nurse Practitioner. Welcome to the Elite Nurse Practitioner Show, podcast dedicated to nurse practitioner entrepreneurism and achieving financial freedom, where I talk directly with nurse practitioners who need help. Listen up. Our market is saturated. Jobs can be scarce. We are underpaid. We are undervalued. We are taken advantage of by the sharks within the healthcare system. And frankly, screw that. I'm sick of it. And it's time for a change. And listen, I'm here to help make that happen. We are powerful. We can forge a path where we are in control of our career and ultimately our financial and personal well-being. You do not need to submit to healthcare administrators and your doctor overlords. You do not have to take a measly salary. You do not have to work 50 to 60 hours a week. There is a different way, and I'm here to show you that path. This podcast is raw and unfiltered. I have not talked to the nurse practitioners in this podcast prior to the call outside of an email exchange to schedule the episode. What you're about to listen to is a consultation session between a nurse practitioner and myself. It is real, it is unscripted, it is unplanned, and I have no idea what we're going to talk about. Anything and everything can happen during our conversation. The nurse practitioners in these episodes are struggling with an issue in their professional or financial life, and they have reached out to me for help. My goal is to help the nurse practitioner with actionable advice that will enhance and improve their professional, business, and financial life. My other goal is to hopefully help my nurse practitioner sisters and brothers build a more productive, powerful, and free life. So I hope the content and information within these podcast episodes does just that. All right, onto the episode. Hello, everyone. Today we'll be talking to Jen, who is a family nurse practitioner. Currently, she's working part-time doing community health and addiction medicine. She recently started a primary care practice, but has integrated a variety of niche services, including weight loss and hormone replacement therapy into it. Additionally, she's wanting to expand her services and open a med spa in this location and eventually branch out. She's needing help with simplifying her business, transitioning to cash only, and building her business in a way to where her services could be separated easily in the future. Hey, Jen, how are you?
Good. How are you, Justin?
Hey, I'm good. Thanks for hopping on here. So tell us about yourself. How long have you been a nurse practitioner for? What sorts of things you've been doing?
I've been a nurse practitioner for a little over 7 years. It's been about coming up on year 20 overall in healthcare. I've worked as a CNA, worked my way up to the top. I've worked in just about every setting with the exception of surgery, including correctional facilities and doing inpatient home type of evaluations as well. So I'm pretty fairly rounded as far as treatment and options to take my business in. So that's what I'm struggling with is because I have a lot of jack of all trades. I just need to decide what I'm going to be a master of.
Sure. Yeah, that's honestly, that's a problem that affects most nurse practitioner business owners.
Yes.
Like they just want to do everything. And in reality, it's just that, it's not wise. You want to offer a variety of complementary services. It's stupid just to do one thing. I think that,
Yeah.
if you're going to offer weight loss, also offer hormone replacement therapy, why not?
Yes.
Yeah, but no, I get that. I mean, when I first started my business, I was dealing with the same issue. So I get that. So from CNA to nurse practitioner entrepreneur, congratulations. Yeah.
Thanks.
Yeah. Well, cool. All right. So you're still working part-time and then you started this practice. How long ago did you start this practice?
I opened February 9th and
Okay.
so the insurance, I've billed around $5,000. I mean, there were some days I didn't have any patient scheduled. We're up to around 3 to 5 people a day, which there's more coming on that. But I've only seen the copays and I've had 2 reimbursements from insurance. So been
So,
salty.
right. So you've only been open a couple of months. You're already experiencing the pitfalls and the pain in the ass it is.
Right. And I'm doing it myself. I am part of a few groups on Facebook, and I've talked to some of my friends that are NPs with their business. And, I took it to heart, and I've also had personal experience. You never let somebody else control your money. And so I want to learn the business from the bottom up. So I'm doing the billing, and I do enjoy it in a weird way, but I don't enjoy it with everything else. And then the insurances, each one is different. it just doesn't need to be that hard. That's not what I'm doing the business for. I'm doing the business to have a better lifestyle, to have better quality time. And that is not the answer with this insurance. No,
Right, right. You didn't start
no.
this business to give yourself a job.
Right.
Right,
Exactly.
right.
Yes.
Yeah, that's kind of what happens when you do insurance a lot of times. You got to deal with just,
Right.
all the pain in the ass associated with it. So you're doing that, plus you're seeing
Hmm.
patients, plus you're working part-time. Yeah, it's
It's
exhausting.
exhausting. Yeah, it
Yeah.
is. And recently I contracted with, I served in the military. I don't really consider myself a veteran. I mean, it was all reserve time. I didn't deploy, but I have 9 years under my belt. So there is a company that does exams for veterans and also active and reservist members of the military. And I remember using them, being required to, so I contracted with them to do exams, and they are blowing up my schedule. So, one question or opinion I would like is how much of that, I don't know if you ever heard of LHI, but I don't know how much of that could be a base bread and butter for the primary care type practice to keep that, because I actually have 3 LLCs. So, we're just focusing on the primary care, but they are really sending me a lot of patients, and I feel that I can get rid of this insurance problem because everything goes through them and through the government, and I don't have to deal with all the different insurances.
Right. So you want to do the veteran disability exams on your own, basically.
Oh, yeah, that's exactly what it is. They come to my practice, I assess them, I enter the assessments through the portal. I am not prescribing anything, I am not diagnosing, I am providing a medical opinion only, so it's pretty
Right.
easy breezy.
Yeah, I don't. Okay, so listen, first off, I
Mhm,
don't know a whole lot about veteran disability exams other than what I've talked to some other MPs who do them.
okay.
The reimbursement's not fantastic on it, so I
Right.
hear. Yeah. Um, and it's very monotonous.
Mhm.
You're not really using your brain. Um,
Right, which
yeah,
I was hoping to keep that part-time because I worked the numbers. They're mostly level 4, level 5 visits. So with the reimbursement of just going at a level 4, if I see 16 of them a week and just break it up into 2 days a week, I would bring in a little over $10,000 a month. And then if you cut out that 30% for taxes, I'm bringing home around 7,200. So the practice is paying for its bills. It's paying me not as much as I would paying.
how
Um,
much? Yeah, but how much time is this taking a week from you? About
it it would be 2 8-hour days,
so 16 hours.
16 hours.
So 16 hours a week, 60 hours a month for, 10,000 bucks in revenue.
Mhm.
Um, it's not great. You could
Right.
do a lot
Well,
better.
they have them scheduled in 1-hour slots, and I haven't started doing them yet. So my thought is it may not take that long to actually see them. So that's just, again, the most conservative evaluation of it. And the reason why is I've already started the LLC for the primary care, and I hate to just toss it to the side. That's really the problem for me is I have created this LLC and I want it to work in
Oh,
some function and be used.
listen, don't let the LLC, wag the tail sort of a thing. You know what I mean? Like,
That's a good idea.
big deal. I mean, I have over a dozen LLCs. Big whoop-de-doo. Like
Mhm.
it's a couple of $100 you have an LLC, you have a bank account. Like,
Right.
don't let that guide your decisions. That's just not. I don't think it's a very wise business move. Okay.
Okay.
So you work 60 hours a month, you make $10,000. It comes out to be, a little over 150 $150 an hour. Okay,
Yeah.
that's pretty good money. I mean, it really
Mm,
is. Like if you do that on
It's the bottom of what I would like to make an hour.
yeah, like I mean, if you so listen, if you did that full time,
Yeah.
you'd be making probably over $300,000 a year, but you would just be
Mhm.
doing VA disability exams. Like you'd
Right.
end up just dreading it. You know what I mean? It would just
Oh,
suck.
yes.
Yeah. So, and plus you're working a lot, right? You're exchanging your
Right.
time for dollars here. Like
Right.
you're not building a business that works for you. So I don't know. I mean, it's an okay way to bring some money in until business starts up, but
And
outside of
that was
that,
my thought on it too. And the to add just a little bit more is the family practice is what the community knows now. I have another LLC for medical marijuana. This is a very, very conservative community. I don't put it on my wall. I don't put it anywhere at my business. It is all coming to me from people looking at my website, and surprisingly, I am getting a lot of business from that. Um, but part, my primary care is the business that the community knows right now, and so that's one of the reasons why that perspective of, oh, she's already changing this or she's already doing this, so business must not be the greatest. It's no, what's coming through my door is people seeking more of a functional medicine spin
okay.
on
So
primary care is what's coming in my door right now.
So then that's what you focus on. That's what you're feeling like. That's
Yes.
what's needed, Now, listen, you've only been open for a couple months, okay?
Right.
So you changing the whole feel, the vibe of what it is that you do and the perception from the community. Listen, you've been open for 2 months. Don't worry about
Right.
it. If this was something that
Okay.
you've been open for years, then that would be something that I probably would be a little bit worried about. But that's not the case, right?
Right.
So I wouldn't again, I wouldn't worry about that. All right.
Okay.
If you're gonna change your services, now's the time to do it. Okay.
Right. Yeah,
Yeah.
especially with the insurance. So that's I have a few folks that whenever I worked primary care before, they were very upset that I left and went to a federal job. And now that I'm back practicing in primary care, they're very happy I'm back. But again, they want to use their insurance. So my thought was, because it's commercial, it's not Medicare, not Medicaid. I'm not allowing them through my doors. I've decided that I'm done. My husband might have a stroke, but he's not paying these bills. But
Yeah.
his opinion is that it just needs to be insurance and do things the traditional way. Um, being married for almost 12 years, he should know that doesn't work with me. But um, my idea was to send out notices to those patients that I've got that I am not accepting insurance. It is cash pay. And I am having a rough time finding a sliding scale for what nurse practitioners basically charge patients for their care needs for, basically like level 1, 2, 3, 4, 5 visit. And I would not be accepting any new patients. These are just patients I've already got. They're some of my old tried and true people that I used to have. So I don't want to basically let them go again because they weren't too happy the first time I did that. But how do I just transition that over? Just give them a notice with an end date?
Pretty much.
Okay.
Yeah. Yeah. I mean, you just tell them, this is kind of what it is, and that's it. People are
Right.
gonna
Your
leave.
insurance ridiculous. Yeah.
Yeah, people are gonna leave. I would expect maybe 20% to hang around.
Well,
Okay.
some of them I'm not. There's really only a handful that I don't know how you feel about friends and family discount, but they would get a friends and family discount. You know.
Yeah, listen,
Yeah.
if they're using their insurance and you want to keep them aboard, do what you got to keep some money coming in, get a little bit of a
Yeah.
discount, whatever, help them
Right.
out, but moving
Of
forward,
course.
all new patients don't get that, you
Right.
know.
They get cash. Right.
Correct. This is the cash rate. So you need to make sure that if you're going to be transferring over to cash, that you do it sooner than later, because the
Right
more
now.
patients do it right now, exactly, because you do it later on, it's just going to become a real pain in the ass, and you start getting these golden handcuffs on you, and it's hard to break from that. You know what I mean?
Yes. Yes.
Yeah.
And the appointment from and essentially I can use the veteran assessments are a really good way of filling out my schedule and getting me paid and to just justify to patients I'm doing this and not focusing, because there have been some train wrecks try to come in through this door and I'm like, no, I don't want to practice that type of nursing care. I don't want to provide any train wrecks. I don't want that through my door. I don't want that headache.
I don't blame you, and
No.
I don't blame you at all. Like let
Yeah.
the
Well,
internal
they
medicine
have
guys take care of
resources.
that.
Right, they have resources in this community, so I guess I'll move on to the second one because, yeah, I'm just going to change that over to cash only for any new people and transition the old folks to cash, whether they may get a friends and family discount, and then move the LHI folks into their spots to essentially make the family practice business pay for itself. Essentially, it's paying the utilities here is what it's doing.
Yeah.
The other business I did, so I had an artistic liberty taking with a tattoo that I had gotten. And I was upset about it, of course, because they're very difficult to remove. So I had taken a laser tattoo removal course and I did invest in a machine because there are tattoo artists everywhere.
Sure.
But there's no places to get them removed. So that is an aesthetic procedure. And I know you don't really discuss it in your courses, but is there any info you have on that? I mean, I have done a lot of research. I've even tried to see who's been sued over doing that. The only person I've found of any substance is a guy practicing that didn't have any education, wasn't even a
Well,
nurse or anything. But
right. I mean, what's the worst that's going to happen? An infection, like if you're doing sterile
thermal
technique,
burn. Yeah.
yeah, a
Yeah.
burn,
Everything's cleaned. Yeah.
right? Everything's clean. You're doing it right. I mean, what's the worst that's going to happen? They're signing a consent stating that they
Oh, of
understand the
course.
risks and benefits. You're removing their tattoo. That's it, right?
Yes.
So, I mean, I don't know much about the clinical component of that, but I mean, I know the business aspect of it. I know people who do it.
Mhm.
There's a girl in my city. I mean, I only live in a town of 100, 150,000 people, and she kills it doing that.
And
You
she's an
know,
NP
correct.
and it's independent practice because that's my issue.
Yeah.
As I was telling you earlier, the very conservative community and some of the other NPs that I have talked to, they have had some issues with people just causing trouble, essentially reporting them to the state for this or
For laser
sending.
tattoo removal,
No, not for laser tattoo, just for family practice
for doing
just to
what?
give them trouble. Just being a nurse practitioner. It's a very conservative community. And even though the state I'm in has had independence since 2015, the physicians are not very happy about it. I mean, they've even received
Uh,
these letters from the docs that are basically like, you're a loser, you're not going to succeed. And they've had some issues come up that you can't, it's technically hazing. So that's my issue
uh,
is hazing
oh,
coming my way.
fucking blow me. My goodness. You
That's
know,
what I needed to hear.
get a fucking life. Come on.
That's why
I
I'm looking up all the litigation and the fines and the issues because I already see it coming my way. And if it doesn't, that's great.
yeah.
Um, but
Like seriously,
just yeah,
you've been independent for almost 8 years now. Get over
yes,
yourselves. Like
yes,
this is my business. This is how I'm going to do it. If you don't like how I do it, come over here and blow me. You know what I mean?
mm-hmm.
Whatever. That's ridiculous. Don't worry about it. Seriously, don't
Good,
worry about it. Make sure your I's are dotted, your T's are crossed.
yes,
Make sure you're not doing anything insane. Let them report you. Whatever. You know
okay,
what you should do? Report them for being an asshole. Just
yeah,
find something that you don't like about them and report them too. They want to play that game, play that game. That's ridiculous. So
it is.
do not worry about that. Don't let that
Mm-hmm.
fear of something like that prevent you from doing what you want to do. Okay. I know
Yeah.
so many MPs this has happened to before, and it is always thrown out every single time.
Mm-hmm. Well,
Okay.
that's one of the, I will say with my personality. And while I was making fun of my husband earlier, is I don't do things the traditional way. I never have. So I know I will do it. It's more of my question was, have you come across any legalities or anything I haven't already found? Um,
About
or
what?
any other insights just about doing laser tattoo, anything with lasers,
No,
anything with Botox fillers, because
no.
I'm going to do all of that and then incorporate some functional medicine,
Okay.
um,
Okay.
and do
Listen.
like the hormone and everything.
I mean, you're providing a non-necessary medical service, right? This is not a
Right.
medical
Yes.
necessity whatsoever. Okay, it's an
Right.
elective thing. They sign consents. They understand the
Mhm.
risks and the benefits. Can bad things happen? Of course it can.
Sure.
Sure. You give someone Botox or something, and God forbid it causes some, a horrible cellulitis, or you
Mhm.
do a filler and it gets in their artery or whatever. Bad stuff can happen. Of course it can. I mean,
Yes.
don't you haven't signed consent, you do your best. I mean, what else can you do?
Hmm.
You know,
Okay.
like, so, I mean, if you want super low liability, low risk stuff, then do VA exams, right? But
Right.
yeah,
But
but
that's
that,
not where the fun is.
that's
I like procedures.
right. That's not where the fun
I
is.
love
That's not,
that class. I didn't mind getting fried and I didn't mind frying other people.
well, there you go. So yeah, so don't worry too much about that. You can't let that fear limit you.
Hmm.
Fear is going to hold you back.
Yeah.
Fear is the mind killer. Fear is going to prevent you from doing everything that you want to do. You're
Hmm.
thinking about these worst case scenarios, these what if kind of things. And sure, listen, if it happens, you deal with it. But
Right.
I couldn't tell you the amount of sleep I lost when I first started my businesses. And even years after I started them, how much sleep I lost about these what ifs. What if this happens? What if that happens? What if I lose my license? What if I go bankrupt? What if, what if, what if, what if?
Hmm.
And I'll tell you what, out of all those what ifs, how many have happened? Zero.
Okay.
Okay.
That's reassuring.
Well, yeah.
Now, I will say the idea I have not really come across it just in general. So the idea I have currently, it is a med spa, but also functional medicine with vitamins, evals, things like that. And I have a psych NP that wants to go in on that as well. So I have a lot of other I really feel like the second business it will explode and the first business is just going to taper out.
Your first business being primary care, your second business being more
Yes.
this niche service stuff.
Yes,
Correct. Okay.
because there's nothing like it around here. So that my idea is my office already looks like a spa anyway. And I would offer, of course, the laser tattoo, hair and yeah, laser tattoo removal and hair removal as well. The Botox, fillers, the hormone treatments, hormone evaluations. There's a lot of women that just want the evaluations to see what's going on and do more natural ways to fix it. And then the weight loss, I've seen the entire gamut of people not out. I do a diet plan with them. I do an exercise plan with them. And I'm going to plug one of your vendors, but Body Metrics, amazing. I got their tool, the ultrasound tool. They love seeing how much, well, maybe they don't love, I call it the terrible awful, but it shows them how much their fat percentage is in their water, and it's able to measure out just how many inches of fat they have on their body as a motivator, especially whenever we reeval. So a lot of it may not be focused towards the medication making the money off of for some of these treatments, but it's more based on I'm going to have to charge based on how on my services to treat them. So that's as far as the money wise of how it's going to work. It will need to be charged based on hourly or even half an hour of my time, not so much marking up medications because a lot of them are not doing the meds. They don't want to do the meds. They're actually looking to do more of a natural way of doing things. So that has changed me into thinking of doing a more natural, holistic type of functional med spin, including saunas, including doing massage. I have a massage therapist that may be joining in June. Um, so that is my idea. In addition, in the future, hopefully in the next 2 years, incorporate it with a full on gym.
Okay.
So what I haven't seen that before. So I was thinking how that would work because some things are complementary and some are not.
Right. I, you're pretty confident this is going to be something that's needed in your area or that will
Well,
do well.
I let the laser tattoo um essentially leak out and I had people sending me emails and calling and leaving messages of when they could come make an appointment. And I mean, I was just by word of mouth. There was nothing on websites, nothing out there. So for sure, the laser is going to explode. Now, as far as the
Let's go
Botox
over
and fillers, yeah,
each service that you want to do,
yes,
and let's just break down what you feel like will do well, what will be complementary, what will be the main service. But
right.
before we do that though, how big is the area that you're living in? What's the population like? And basically in the city and the county. Do you have any idea?
So I know what, I didn't look that up. It is a smaller town.
What would be your guess then? Well, look it up real quick. So
Yeah, I'm
that
almost
way
done.
we kind of know. Yeah. 'Cause I mean,
So the pop 968. So in the county itself, because where I'm at, that's the other thing. I am in an area that intersects with 3 different states, and there's nothing within a good 40, 50-mile radius that is of a metropolitan type area.
okay.
So a lot of it is kind of back country type setting, but you also have, again, a lot of the tattoo shops. And there's a lot of prisons where I'm at. So you will see a lot of tattoos just from that type of, I guess, lifestyle. You can see, not from the inmates, but, some of the staff like to get tattoos. And then also there is a type of,
So
I don't know, like wrestling, but like the WWE style. So you have a lot of uh, that type of folks around. But
so
yeah, tattoos seem to be something that people do a lot of around here.
yeah. I mean,
Yeah.
hell, it's pretty much a fad anymore. I mean, I got
Yeah.
a full sleeve, a chest tat, a half sleeve. I mean, stuff on my legs, like. All right. I hope everyone's enjoying the episode so far. I just wanted to take a quick break to thank everyone listening and also give a big thank you to all of my social media followers and email subscribers. If you haven't done so yet, please subscribe to our email list at www.elitenp.com and make sure to follow us on Facebook, Instagram, and LinkedIn. Email subscribers will receive updates on new weekly podcast episodes, multiple weekly articles we publish, new courses, and everything else related to helping you succeed. Remember, all elite nurse practitioner courses are designed to help you build a niche practice, increase your financial strength, and to break free from the rat race. If I can break free and the other countless nurse practitioners can break free, then so can you. Additionally, please share this podcast with your other nurse practitioner sisters and brothers out there. The more NPs that venture out on their own, the stronger our profession will become. Now, let's get back to the episode. What's the population in your county?
The county is actually more of 3 different areas. So there's 28,000 people in this county, but I'm right close to the border of another county as well that has a state college or state university there as well. And there's also a community college close by.
And how far is that
next,
from your house?
From the
Drive-wise?
business, it's about 15 minutes, 20
15 minutes.
minutes.
Okay, so that's
Yeah.
part of it as well. So basically what you're telling me
Right.
is that you probably got 50 to 100,000 people within a 30-minute drive of your clinic.
Yes, absolutely. And that's just in this state. I haven't looked at the other counties.
Yeah.
'Cause
So
yeah. So there's a
yeah.
lot, there's nothing like this anywhere.
Okay.
And then with the county I'm located in, as I said, there's kind of 3 different developmental type of areas. I specifically chose the northern end because it's relatively undeveloped
Okay.
as far as this, where there are some options where it's more of a tourist area, and then there are some options where the county seat is, where a lot of the offices and things for the state are, or for the county are.
Yeah. So you got the population that you want.
Yes.
That's not an issue whatsoever. Okay. So services here. So laser tattoo sounds like a slam dunk. You already own the machine. You
Yes.
have the training. I mean, that's a
Yes.
no-brainer.
Yeah. And that
Okay.
in
Like,
itself, I mean, you charge on at minimum $500 for them to come in the door and get up to 5 sessions. But it typically takes 9 to 13 sessions to remove it completely.
okay.
You just do the rest of them a la carte, but you're getting $500 up front, whether they complete it all or not. If they decide it's not their own
Is this
idea.
something that can be delegated to an RN?
I could delegate it to an RN, and that is part of my expansion thoughts as well, because, I can
Yes.
be a medical director. So one of my ideas is actually for the primary care. That's going to end up, I'm going to hire an NP to deal with that.
Okay.
once I want to go to working less time
Sure.
and doing the fun stuff.
Okay. So for that first, you'll be doing it, but it's something you can outsource later. Good. Slam
Right.
dunk. Do it.
Yes.
No brainer.
And
Okay.
that's where I was going to start, is laser tattoo and then Botox.
Botox. Is there competition? I'm surely God, there's some people
There
doing it.
are some, but they don't advertise the greatest. I did not even know they existed. So I'm not sure how they're advertising.
Okay.
And I am right next to a hair salon.
Okay, so no brainer. Okay, I mean, no brainer. Like you doing some of this aesthetic stuff, especially if you enjoy
Right.
doing those procedures.
Oh, yeah.
No brainer. If there's not a whole lot of competition, you're gonna get busy. Okay.
Yes.
Now, what about the other services that you want to do, like weight loss? What's
So
the
weight loss, I'm getting a lot of folks in. So that's the issue, is the aesthetic and the more functional / weight loss part of it. Um, I see a lot of folks with the weight loss, and they don't really have the time for the exercise, even though they see what the body metrics shows to them with their health and with how much body fat they really do have, because BMIs aren't reliable. And one of the goals, or eventual goals, I have would be almost to have a private YMCA like facility, but it's more where there's a gym for parents to go to. Their kids can go over here and play with a babysitter that's watching over them, to take away that burden for them. And then also, if they need relaxation, have a sauna there, do the massage, um, do the cold therapy, possibly include a pool. There is a pool, a community pool at the college. Actually, there's a whole other college I forgot to tell you about. So there's like 3 colleges, university right in this area within 15-20 minutes. But anyway, um, it's not easily accessible. Their hours are different, and I hear they're a bit expensive. So it'd be almost like you would pay a monthly fee, and you can use the majority of the resources there for that monthly fee, with the exception of the massage. Of course, the massage therapist is going to charge their rates. Um, and then, of course, my fee for the weight loss consultations.
Yeah. I mean, it sounds good, but let's just try to keep this
Mm-hmm.
simple.
Yes, I
Okay.
definitely,
This
these
is
are, yeah.
like, yeah, you're thinking way too far in advance here
Oh,
of
yeah.
stuff that, like, let's just get this shit profitable first. Okay.
Right.
Like, let's just get some patients in the door and get you to start making some money. Like, you might
Exactly.
realize that you might not need to do all of this stuff. Okay.
Right. Well, I intend to announce this. I'm actually going to give a call to my insurance provider, because they're supposed to have gotten back to me already about the coverage for the laser tattoo, because a lot of these med spas for NP coverage, they don't throw in the tattoo laser removal. They just miss out on that.
I don't
So,
even know insurance would even cover something like that. It's not a necessity.
right. Well, it's just for liability. Just, yeah, my own
Your
liability.
malpractice. Okay, I got you.
Right.
Right.
You're right.
Okay, so I feel like we're going down rabbit holes here. Let's stay focused.
Yes.
Okay,
Yes.
so your aesthetics, your laser tattoo removal, weight loss, hormone replacement therapy.
Hmm.
Let's just call it there. You don't need to do too much here. Okay, you start
Okay.
doing too much stuff, you're gonna be your focus is going to be all over the place. You're not going to get shit done. Okay,
Right.
you got to really stay focused in here on what it is that you want to do. Like, all this stuff complements each other. Okay.
Yes.
All of this stuff, the patients who want aesthetics will also probably want some HRT. The people who want weight loss might want some aesthetics. Like, this is all going
Right.
to complement each other. Laser tattoo removal, maybe not, but that's a great little niche service that people are going to want to pay for. Okay. So
Yes.
I say stay focused in on just these things, and don't start going down rabbit holes of a bunch of other stuff, because first you got to prove to yourself that you are capable of opening a
Hmm.
profitable business that's cash based. Okay. Prove to yourself you can do that. Get it going. Start making enough money to where you can leave your job. Okay.
Oh,
You
yes.
can leave your part time jobs. Okay. These are the goals that you need to be focusing in on right now first. Okay. Start making enough money so you can leave your job, and start making enough money to where you have reserves in your business
Hmm.
bank account that you can then invest in your business. Okay. Because the last thing you want to do is start taking out a bunch of loans and stuff.
Oh, yeah. No, I built this. I did the build out, with help from my husband and my dad.
Okay,
But
perfect.
we kept it cheap. I mean, it was just an open area and built a lot of, just basically build it out for an office. So that was kept to a minimum. Opening it was a minimum. I was buying supplies up months before it was even done. So I already had those bought up. So there's not a whole lot of money invested into it.
Okay, good. Keep it that way.
Yeah. Yes.
Keep it that
Yes.
way.
That's why I was like, I'm working these other ones because it's covering everything. But my goal is for this month, it almost covers its rent. And then my goal is for next month, it's covering everything and paying me for about a week's worth of work.
Sure. Yeah, I think that's possible, especially if you don't have a whole lot
Yeah.
of competition. I think what you're going to end up finding out here is that you're going to make so much money off of weight loss more than anything else
Mm-hmm.
that you're going to just start thinking to yourself, gee, should I really be investing my time and energy and all this other stuff? Like, I'm making a shit ton of money just off weight loss. You know what I mean?
Yes.
So I think that start all this stuff, do all these things that you want to do. Okay. Leave it at these 4 or 5 services. Don't start doing more. Okay.
Mm-hmm.
If you want to do some functional medicine, primary care, fine. That's all complimentary as well. But
Mm-hmm.
just stick with these things here. Don't go down rabbit holes. I feel like that if you do, you're never gonna be able to focus in and be successful. Because like you said earlier, being a jack of all trade and not a master at anything, that's not what you want to be. And if you start going down all these
Right.
rabbit holes, start doing all this stuff, that's what's going to happen. Like when I go to these practice websites and I click on about us or services or on the main page, I'm like, what is it that you do exactly? Because it sounds like you do
Mm-hmm.
everything. Like I'm not feeling
Right.
confident. Like you're doing addiction medicine plus aesthetics plus Department of Transportation exams. Like what the hell are you doing? This doesn't make sense. So you don't want to be that
Right.
kind of person. You want to stay very, very focused in on these niche services. Call it a med spa, call it a wellness clinic, whatever it is that you want to do, and just leave it at that and
Okay.
let it do its thing. It will get busy. I
Yes.
promise you it will.
It's already starting to get busy, and that's why I reached out because I knew that I needed to make a decision on what I'm going to do now.
Well, it sounds like you've already made that decision. Like you don't want to,
Yes.
you don't want insurance. I agree with you. Scrap it. Okay.
Yeah.
Scrap it. Keep the LLC. Keep it. Keep the entity that's credentialed. Keep it there. Keep it. Why not? But just all this other stuff that you're doing under a separate LLC, it's not credentialed, and that way you don't got to worry about it.
Right.
You don't got to cancel your contracts. You don't got to do none of that stuff. Okay.
Which I would do a shout out for the Wyoming LLC. They're great. They're amazing. They
Yeah.
have everything you need there.
Everything you
Phones,
need. Boom. Get the
website, all of
LLC.
it.
Yeah,
Yes.
and then just get going. Okay. I would advertise each service line separately and see what
Okay.
happens. Okay. So you can advertise the weight loss, advertise the laser tattoo removal, etc. See which ones take off. But I suspect the weight loss probably will take off. Laser
Mm-hmm.
tattoo removal, that'd be one of those things that you could honestly just go to tattoo parlors, walk in and be like, hey, I'm
Oh, yeah.
offering tattoo laser removal, just FYI. Here you go. Can I leave some cards here or whatever,
Yeah. I know of 5 right offhand that are literally in the same kind of geographical spread, same patient, or I guess, uh, person availability opportunity that I have here. So
Perfect. Well,
there's
there you go.
there's 5 of them to 1 of me.
Right, right, right. Well, there you go. Okay. So stay focusing on stuff. Don't go
Yeah.
down rabbit holes here. You're never gonna get anything done.
Right. There's some things I need to update my website for the primary care because I've did one DOT exam and they're just not
Oh,
worth my time. They are just not
ah,
worth my time.
DOT
And
exams suck.
they do.
Yeah.
And yeah, so those are ridiculous. And honestly, I haven't gotten much of a bite on the testosterone, surprisingly.
Well,
So yeah, I'm having a couple of my friends, family members spread the word um to like their because they work in um the, He's a policeman, so he
Sure.
has friends. He actually does it as well, but he goes like 3 hours down the road,
Oh, hell
close to
no.
where the barrack where he works. And I'm just like, you know, how about I help you out with your dosing and you bring your friends.
There you
So
go.
that's in the process now. And then I'm looking into, because again, it's a rural area, but you have a lot of farmers, you have a lot of hardworking guys um, that would benefit from it. You know,
100%.
you also have some affluent people, but there's a couple of golf courses, but they're not really, they're not the
Well,
greatest, what I'll say.
okay,
So
the
yeah.
thing about testosterone, hormone replacement therapy, and weight loss,
Mm-hmm.
people are looking for you. Okay.
Yes.
So you just got to make sure that you make yourself as easily found as possible. That's all you got to do. I get people who email me all the time struggling. It's just like these people are looking for you and you're not doing anything to make it easy for them to find you.
To find it. Yeah.
Okay.
Because I've tried to target some of like the sheets where I know people are just standing around looking at stuff for at least some of them. Just put up little flyers with the little tabs you can tear off. And I went back and followed up and I'm having some tabs come up missing, which is
Good.
nice.
Yeah.
So
Well, go to the Elite MP website.
mhm.
I'm not gonna go over this in this podcast because the article outlines it pretty well. Go to the Elite MP website, click on blog articles, and in the
Mhm.
search bar there, type in DBA. Okay.
Okay.
I wrote an article about how to do multiple DBAs. So basically, how to advertise multiple services
Under the DBAs instead of the
under like
LLC.
correct. So it looks like this is a testosterone clinic. This is a weight loss clinic. But in reality,
Okay.
you do multiple things, but you're just advertising it as those things. And people
So
find
how
you.
do you do the Google? I've had just getting the medical marijuana associated with the same address as the primary care was a disaster. But it's finally up and going because people are finding me that way. But how do you get around with the getting a Google listing for each one of those?
Yeah, technically, you're only supposed to have one Google business listing per address.
Right.
Okay. So it's difficult to do that unless there's suites, basically. So you could
Right.
put suite 1 and 2 and 3 on your door or whatever, and then just put on
Hmm.
Google suite 1, suite 2, suite 3. Um, so you could do that if you wanted to. It's all at the same location. So,
Hmm.
but if you put just the services in your name, like whatever
Yes.
wellness clinic, hyphen testosterone replacement therapy, aesthetics, etc., then these
Hmm.
things should come up. But if you have separate websites for each one of these services, like I talked about in that DBA article,
Hmm.
then it's a lot easier. People can find it a
People will
lot
find it easier. And then
correct,
you could do an online listing, I suppose, and then just use the identifiers for your area where you're targeting.
pretty much.
Okay.
Yeah, yeah,
Makes a lot of sense.
yeah.
Thank you.
Stay focused here, okay?
I know. I knew
uh,
I had shiny object syndrome. I really
yeah,
did.
yeah. Listen, we
It
all
was
do.
bad.
Yeah, it's just a thing about entrepreneurs, business owners. Okay, I suffered from it, and I'll tell you what. When I finally overcame that and focused in on just a couple things, my net worth and success skyrocketed.
Okay.
Okay, so stay focused, and I think what you'll do is I think you'll find that you'll benefit significantly. So, yeah.
Yeah. And
Any
work
other
less
questions?
hours.
Exactly. You work less
Um,
hours.
yes. No, I think that's great. I've helped me out a lot. So,
Good.
one question is, and I think I already know your answer, but if I just still feel uncomfortable about someone being not a nice player in the sandbox, is it even worth it for my peace of mind to even look into possibly hiring a physician just to have that coverage? Or is it that's just something stupid that I'm just using as a crutch?
It's a total crutch.
It's total crutch. Okay, that's
Come
what I
on.
thought.
You're
Yes, I know. I knew
independent.
that answer.
Like, you know how many MPs listening to this right now are probably in a restricted state and being like, what the hell is wrong with this woman? Like,
Well,
you
the
are
greatest
independent.
thing,
Don't
yes.
worry. Like, yeah, like you have such a blessing here. Take advantage of it. Don't worry about someone reporting you to the board of nursing over
Mhm.
something stupid. Like I said, You're doing
Oh, I've already talked to the board of nursing. They're basically like, if it's in your scope of practice, I'm like, well, I have training, so I guess that's in my scope of practice.
100%. If you could show them a certificate that shows it
Yes.
and some training, they're going to throw out the complaint and be like, they're going to roll their eyes and be like, geez, really? You know,
Right.
this is something that you probably wouldn't even have to go present it in front of the board. You wouldn't even have to hire a lawyer. You would just respond with a letter with your certificates and it'd be thrown out.
Yeah.
Yeah.
So, I forget what I was even. Oh, that's the other thing, since you mentioned the state that's directly north, which is only about 4 miles to the border, has finally introduced legislation to allow nurse practitioners partial independence after they've had 3 years of a collaborative agreement. So I really hope that does, because that will really that then I can actually move more into that state with advertising as well, because they're completely restrictive on NPs. I can't even own a business there. Like, if there
Yeah.
is a clinic that's of medical of any nature, has to be owned by a physician.
Yeah.
Yeah.
Nonsense.
So I'm excited that, like with your recent article, as far as looking to the future, again, my shiny object syndrome, that's one area for expansion that I'm looking into for possibly within 5 years, with my 5-year plan is
Hell, you could
building up
probably
some things there.
you could go there in 2 years,
Right.
First get this location profitable, get up to $50 to $100,000 a month, then expand.
Yes. And there's definitely lots of opportunity there too.
Yeah,
So, yeah.
perfect. Yeah. Anything else?
But I think that's all.
Cool. All right. So I like to end the episode with you asking me a question. Do you have a question for me, a personal question or a curiosity?
I know that you have talked about how you wished that you would have quit your side jobs a lot sooner than what you did. But is there a wish or a thought looking back where you felt you should have developed one of your side businesses sooner?
You mean like sooner in my career as a nurse
Right.
practitioner?
Right. Where perhaps you should have expanded or developed a business sooner than what you did.
Oh, geez. Yeah. Like I seriously wish, yeah. Like, okay. So I graduated NP school in 2013. Okay.
Mhm.
So I've been an NP for 10 years. Um, and I seriously feel like I could have started my own practice and saved myself years of headaches and disappointment if I would have started that practice within a year or two. I wish I would have just started my men's health clinic where I lived. You know, I really wish I would have just started that within 2 years of graduating because I could have easily did it. I mean, it was men's health's not that hard. You know what I mean? I was working
No.
in the
Yeah. I mean, yeah.
it's not hard. Weight loss is not hard. Like I was doing ER, I was doing urgent care, working my ass off, doing all kinds of procedures and taking care of, train wrecks. I mean, if I could do that, you could do men's health. Like
Yeah.
the limiting fear I had though was that it was a restricted state. And
Hmm.
I had this limiting belief that I couldn't open my own practice up because I had to have a supervisor and a collaborator, and it was just going to cost too much money. It was going to be too much. So instead, I go all out and move across the country to a state in the West that's independent, and then I open up my practice. But
Yeah.
right, like so I do the most extreme thing you could possibly think of doing. You know what I mean? When I could have just stayed put and did it, because I know NPs who have $1 million practices who have collaborators. Like
Yes.
it was a stupid limiting belief. So yeah, to answer your question, yes, I wish I would have did it within a year or two of graduating.
Okay. All
Yeah.
right. So how would you have balanced that though?
In terms
I'm
of
getting back to my shiny object syndrome. Focusing back on that again is what I'm doing. Is like, how would you have balanced that to, I guess, make them, how did you know when you could add on another side business? Let's put it that way.
when I felt like the business that I had was kind of more or less maxed out in terms of the energy I could put
Okay.
into it. So like, my first clinic was a medical cannabis clinic. Within a year of starting that, I was like, this has a very, very low ceiling to it. Like there's only so much you
Hmm.
can do with this. You know what I mean? And so I
Right.
realized pretty quick, I was like, I'm not going to become a millionaire doing this. So then I started my men's health clinic. And then, when I was doing my men's health clinic, I realized after a couple years, I was like, eh, there's not really a whole lot more here for me unless I start offering a lot more services or open up a second location.
Hmm.
So then I started a lead NP right?
Right.
More or less teaching people how to do this stuff. And then that's where I decided to focus all my energies into, because I felt like there was a lot of room there, and we're still growing. And
Oh,
so
yes.
I opened up my second location, my men's health clinic. I was like, okay, 2 locations. We're making over $100,000 a month. I was like, I don't want to put much more energy into this, so I'm not going to. So it's basically just more or less, how much time do I have to invest in this, and what's my return on it? And
But you're
so,
still maintaining them at the rate or the volume that they have been producing. They basically met their ceiling and they just kept going. That was all the revenue you're going to squeeze out of it.
well, no, we still grow,
So,
but I don't work in it anymore.
okay.
I have an office manager. I have other NPs working for me. So like it continues to grow and I make more money and I work less. Like that's what happens when you have a successful practice and you leverage the work of others. Like you work less and you make more money.
Right.
You hear this time and time again from very, variety of entrepreneurs. You work less and you make more money. That's how it goes. But the first few years, you got to work your ass off. You got to pay your dues.
Oh, yeah.
You got to build those procedures. You got to build the practice, and then it starts working for you. So
Right.
you'll know when the time comes. You're just a baby here. Like you just started. Give it a year or two. You'll see.
Okay.
Promise. All right. Well, listen, this was a great episode. Lots of good stuff here. So, keep me updated. If you ever want to do a follow-up, let me know.
All right. Yeah. I think that would be great.
Cool. Awesome. Take care.
All right. You too. Bye-bye.
Bye-bye. All right. Hope everyone enjoyed the episode with Jen. Very long episode, but a lot of good information there. And I think the big thing here is that you need to make sure that you are focusing in on 1 or 2 services at first and then offer complementary services. You can't be a jack of all trade and a master of nothing. It doesn't work, okay? And it's going to drive you insane. You're never going to get ahead. You're never going to be able to get a successful practice going, a successful business going. So you got to stay focused, okay? She's going down a lot of rabbit holes, wants to do all this kind of stuff. Most business owners get shiny object syndrome, and you've got to avoid doing that. You have to stay focused if you want to have a successful business that works for you. All right. Hope everyone enjoys this episode. Talk to you guys later. Thanks. Bye. Thank you for listening to the show. Quick legal disclaimer. The content of this podcast is meant for informational and entertainment purposes only and should not be used as legal, financial, medical, regulatory, or practice-specific advice. For information pertaining to your specific legal, financial, medical, or practice-specific needs, please be sure to consult with your lawyer, CPA, medical director, and/or your state's practice laws and the most up-to-date clinical guidelines. As always, do your due diligence when it comes to any information found online and in podcasts. The content in this podcast is copyrighted by Galaxy Medical Southwest 2023 and cannot be duplicated, rebroadcasted, or reproduced without our written permission.